guys, so I'm back again with another video, and today we'll be talking about bradycardia and tachycardia. Bradycardia is a slow heart rate, basically. There are different heart rates or different beats per minute depending on the age of a patient. For example, a newborn child could have a heartbeat of 100 up to 160, and it keeps changing in range. But today we'll be talking about the heart rate of at least a 15-year-old to 100 or whatever age above 15, and that's between a normal heart rate is supposed to be between 60 and 100. So we have bradycardia, which is 60 or below 60, and then we have tachycardia, which is over 100 beats per minute, and this can be caused by different circumstances. We'll start with bradycardia at first. Bradycardia is a heart rate that is slow. It depends on your age, it depends on your physical condition. For some people it's normal. For example, athletes or people who are physically active, they can have a heart rate of 60 beats per or 40 beats per minute, I'm sorry, and that is normal for them. So it's normally old people or elderly people that are prone to bradycardia. Like we said, the normal heart rate is 60 to 100, but it's very common when you measure values in the morning or when you walk into a patient's room to have a patient who has a heartbeat per minute or a BPM per minute of about 52, and that's normal. Sometimes the heart rate also falls when we sleep, which is also a very normal condition. When we're in deep sleep, the heart rate automatically drops. Some of the causes of a bradycardia, like we said, are deep sleep or physically active adults or athletes who can have up to a bradycardia of to a heartbeat rate of about 40 beats per minute. There are causes to bradycardia, and one of the problems is the heart has a natural pacemaker, and that is called the venous arterial node. So when the venous arterial node has problems, but it's not functioning the way it should, then we get a condition called bradycardia. Another thing that could cause a bradycardia is the connecting pathways of the heart. We have a system where the electrical impulses flow down through the atria to the ventricles, and when this system is not working the way it is supposed to work, then we have a bradycardia, because then the electrical pulses do not get passed down properly to the way that they are supposed to be passed down. It can also be caused by metabolic problems, for example, a hypothyroidism. It would mostly be a low thyroid hormone that could cause bradycardia as well, or a damage to the heart, for example, through aging or heart disease or even heart attacks. Certain medications also cause bradycardia. Congenital heart defects, those are defects that are attained at birth, also can cause a bradycardia, or a myocarditis. Now, this is a membrane of the heart that, if it is affected, can cause bradycardia as well, because then it doesn't pass on or it doesn't work the way it is supposed to work. Or after a heart surgery, you can also have complications that can cause bradycardia. Also, chemical imbalances. We have certain not nutrients but electrolytes, so to speak, that are in our blood, and if they are not in the normal range, for example potassium and calcium, then we'll have a bradycardia. Sleep apnea can also cause a bradycardia, or some inflammatory diseases such as rheumatic fever or lupus can cause a bradycardia. Some of the symptoms of a bradycardia are dizziness or lightheadedness, fatigue or weakness. Some of the patients get confused. Fainting is also one of them, or chest pains or angina is one of them. A bradycardia also comes with complications, for example, heart failure, because remember we said the electrical impulses are not working like they are supposed to work. So sometimes the atria does not get filled the way it's supposed to get filled, or the ventricles don't get filled the way they're supposed to get filled, and so it reduces the flow of blood to the veins, and eventually to the heart and brain, or it could also cause a frequent fainting or a cardiac arrest. The treatments for a bradycardia, do you know what they are? Well, the treatments for a bradycardia are basically adjusting or discontinuing medications that could cause bradycardia, or even surgery, so that an artificial pacemaker is put in place of the natural pacemaker. So let's also quickly talk about a tachycardia before we break off this video. Now, we talked about a bradycardia. It's a slow heart rate, 60 and below, or at least below 60, depending on your physical activity or age. A tachycardia, what do you think it is in relation to a bradycardia? A tachycardia is a heart rate that is over 100 beats. Remember, we said that a normal heart rate is between 60 and 100. So a tachycardia is 100 beats and over. I will show you a skit somewhere about an EKG that shows what a normal heart rate looks like and what a tachycardia and a bradycardia looks like. But there are different types of tachycardia. Now, remember we talked about the system that passes the electrical impulses. We have the upper part of the heart, which is called the atria. Then we have the lower part of the heart, which is called the ventricles. And the type of tachycardia that affects us is also named according to which part of the heart it affects. Now we have an atrial supraventricular tachycardia, or SVT. That is a very fast rate, and it starts in the upper chambers of the heart. That's the atria. So these impulses are affected, and so it causes the heart to beat like really fast. Now there are risk factors that cause a tachycardia, and one of them is the drink that you have in front of you, a caffeinated beverage. So a caffeinated beverage or alcohol can cause tachycardia. Smoking or taking illegal drugs like meth or cocaine, something that's very common in our community nowadays, can cause a fast heartbeat. A coronary artery disease causes tachycardia as well. A congenital heart disease causes tachycardia. Remember what we said a congenital disease is? It's something that some patients acquire at birth. A sleep apnea can cause it, and weight. For especially the patients who are a bit overweight or adipose. Some of the symptoms of a tachycardia, we've already mentioned them. Fainting all the way until unconsciousness can quickly happen. Lightheadedness or dizziness, we've already talked about that. A rapid heartbeat or palpitations happens as well. Fluttering in the chest or chest discomfort. A bounding pulse, fatigue or shortness of breath. Remember, because the heart is not pumping enough blood through the system, so the rest of the body doesn't get enough oxygen, so the body compensates. It can also come to a cardiac arrest. So we have the atrial tachycardia down, yeah? The second type of tachycardia is the sinus tachycardia. What is the sinus? Remember the sinus node? It is the heart's natural pacemaker. A thing you have to note about the sinus tachycardia is the heart rate is really fast, but the heart beats properly. It's a response to exercise, but it's very concerning at rest. So if you're at rest and the heart is still beating really fast, then we have a sinus tachycardia. Yeah. Some of the causes of a sinus tachycardia are anxiety or fright, severe emotional distress, or strenuous exercise, fever, some medications or illegal drugs, and pain. So this is stuff that could really happen. It would happen on a daily. The other less common causes are anemia, or an infection, or an increased thyroid activity. So we've talked about the atrial tachycardia. We've talked about the sinus tachycardia, and let's go to the last type of tachycardia. That's the ventricular tachycardia. And the electrical signals in the heart's lower chambers, they function abnormally fast So they interfere with the electrical signals coming from the sinus node, yeah, or our heart's natural pacemaker. Now, most of the causes of these tachycardia forms are basically the same. Congenital disease, something that was acquired at birth, or imbalances in the chemical system of the body, or you could even have medication side effects. Like we say, some medications cause either a bradycardia or a tachycardia, or even just abnormalities of the heart, most commonly caused by a prior heart attack. We also have a condition that could affect our skin and blood tissue, which could also cause a tachycardia, that is called a sarcoidosis. That's the name of it. Or you could even have a cardiomyopathy, or even lack of coronary artery blood flowing, thus depriving the rest of the heart tissue of oxygen. This comes with symptoms. What are the symptoms? We've already mentioned them. When you don't have enough oxygen going into your blood, or when you don't have enough fluid flowing through your blood, you're dizzy, you're tired, you're weak, you could faint, you could easily faint, you have shortness of breath because you don't have enough oxygen being pumped through the body, or even nausea. Or it could also come to a cardiac arrest, or even chest pain or angina. So what are some of the treatments for a ventricular tachycardia or a tachycardia in general? I mean, you've seen some of them on the station. For example, medication that would prevent arrhythmias, for example. We just talked about one of the causes of tachycardia can be imbalances in electrolytes, potassium and calcium. So they could have calcium antagonists. They could also have a beta blocker. What other treatment could there be? Well, a radiofrequency ablation. An ablation is a procedure that destroys cells causing ventricular tachycardia, or even surgery, an implant. Yeah, an implant is what many patients get as well. That's a cardioverter defibrillator, or an ICD, and that delivers the electrical pulses to the heart. And that was what we had to tachycardia. Remember, what are the three types of tachycardia? First of all, what's tachycardia? It's a fast heart rate. What's the normal heart rate? Exactly, between 60 and 100. What types of tachycardia do we have? We have the atria tachycardia, the sinus tachycardia, and the last one was the ventricular. So every time you're trying to remember tachycardia and how to explain it, remember the portioning of the heart, what the heart looks like, and base it on that. And when you do that, you will never forget what a tachycardia is, or a bradycardia. So thank you guys for watching as well. Thank you for attending with me, and hopefully we'll discuss another type of ailment that we could have in a patient coming with. Until next time.
And I know we're far from perfect, but at least we try. Through every battle